Greetings to all participants joining us from across India and around the world. This is the Prasanna School of Public Health at Manipal University in India, hosting this series. A warm welcome from the School of Public Health, and we are delighted to have you with us today for the fourth lecture in the second edition of the prestigious Professor Rajani Prasanna Endowment Lecture Series on climate change and its impact on health. As all of you know, the first series has been brought out as a book, and this lecture series actually shaped up way back in 2022 with the general support and guidance of Professor Rajani Prasanna, and an ardent art historian and a champion of socio-cultural impacts of climate change. The first edition, as I said, covered governance challenges associated with climate change and public health, with an edited volume published in collaboration with Manipal Universal Press and Springer Nature. We are proud to continue the second edition of the series this evening. Today we will delve into a topic of profound importance, one that resonates not only within Wales but across the globe. With that, I am Cherian Verghese, the director of the School of Public Health at Prasanna School of Public Health, and I am indeed grateful to having Professor Vikas Kapil with us today. And I am passing on to Professor Kapil to take the session today. Thank you.
Thank you so much, Dr. Verghese. As always, it's a pleasure to be here, and it's a pleasure to have all of you joining us today. In this session, we're very, very pleased and privileged to have two distinguished speakers joining us from the United Kingdom, from Wales. And I will introduce them shortly. Rebecca Masters will first be presenting an overview on the public health effects of climate change in Wales. And then Dr. Sarah Jones will share her expertise on how they use data to assess risk, to inform mitigation and adaptation efforts, assess health impact, and very importantly, ultimately, to inform public policy in Wales. I think you'll all find this a very stimulating and worthwhile discussion. So without further ado, let me introduce our speakers. Rebecca, first of all, Rebecca Masters is a consultant in public health at Public Health Wales, where she provides strategic leadership in reducing the public health impacts of climate change. She has over 20 years of experience in NHS public health and brings extensive expertise in advancing health and well-being across communities. She has collaborated and continues to collaborate closely with the World Health Organization and other key national and international partners to drive global health improvement. She holds both graduate and postgraduate degrees from the University of Liverpool, where she's also an honorary research fellow, reflecting her commitment to research-driven public health innovations. Following Rebecca, today we will hear from Dr. Sarah Jones. She's a consultant in environmental public health at Public Health Wales. Sarah has a long-standing interest in the links between transportation and health, particularly how transport policy can benefit health and mitigate changes to the climate. She also works with many partner agencies across Wales to support climate change adaptation at all levels, from Welsh government policy to local community and individual actions. So first of all, I want to thank both of you for joining us, and I very much look forward to the discussions ahead. What we would like to do in terms of organizing the session today is we're going to first have each of our speakers present, Rebecca, then followed by Sarah, and then we will open it up for questions, answers, maybe some open discussion. So if you do have questions or issues you would like to raise, please either note them down for bringing up later, or feel free to put them in the chat, and we will try to sort of follow the chat. Finally, I would be remiss if I did not extend a special thanks to the entire team here at PSVH that has been so instrumental in putting this whole program together, not only today's, but the entire series. So Dr. Cherian's leadership, Vani Lakshmi, Alyssa Martins, who are in the room with me today, Dr. Rahul Claire, who's hopefully joined us online, and several other key people here at PSVH. So thank you to the team as well. So with that, let me turn it over to Rebecca first. So Rebecca, let me turn it over to you. Hopefully you can hear us, and we will, the rest of us, I think, will mute and turn our videos off to minimize any distraction, but let's turn it over to you first. Thank you.
Thank you very much. It's an absolute delight to be here with you this evening to talk you through some of the health effects of climate change here in Wales and how we are working towards trying to tackle those areas. So thank you for such a warm welcome. And what I wanted to do was to kick off by talking through some of the challenges that we have here in Wales and how we've approached our work in trying to address some of the public health impacts of climate change. So as you kindly mentioned, my name is Rebecca Masters. I'm a consultant in public health here at Public Health Wales, and that means that I've taken considerable undergraduate and postgraduate training around the specialist area of public health practice, much like your good selves. And I've been working in Wales now for approximately 9 years. I'm in the United Kingdom, and I have been working on the climate change agenda for 4 years now. And at Public Health Wales, I lead our strategic priority work around tackling the public health effects of climate change. So Wales is part of the United Kingdom. There are 4 nations that form the part of the United Kingdom of England, Scotland, Wales and Northern Ireland. And each of those 4 areas has a different public health agency that leads the public health approach to how we tackle various challenges. I work in Public Health Wales, which is covers approximately 3 million people. We have a temperate maritime climate, which means that it is quite wet, but it's not too hot, and it's very coastal area. What you can see from the picture behind me is a Bala Lake in North Wales, which is one of our beautiful inland lakes that we have. This is a beautiful sunny day, and we do have nice sunny days during the summer, but generally speaking, Wales is not particularly hot, and it's a bit wet, and it's a bit wetter compared to the broader United Kingdom average. I'm in the north of Wales. Sarah, who will be speaking to us later, is in the south of Wales. And there is about a 4-hour time difference between our geographical areas. So to travel from the north to the south takes approximately 4 hours. So that feels quite long for me. I don't know what that's like for yourselves over in India, but it should give you some context to what that geographical difference looks like across Wales. So I've got some slides to talk you through this evening, which really sets the broad scene for some of the public health challenges that we have in Wales. Then I will go through into a bit more detail around our approach, before finally talking through some specific examples around how we're trying to reduce our carbon footprint within our public health delivery services. So within Wales, Public Health Wales operates all of our microbiology labs. So if you go into a hospital and you receive a blood test or any type of test that needs laboratory configuration, that will go through a Public Health Wales lab. And so what we've been trying to do is work through how we can reduce our carbon footprint and our climate impact of the work that happens within that environment. So I'll give you a bit more detail about that as I come towards the end of the presentation. So to set the scene, Public Health Wales recognises that climate change is one of the most significant threats of the century. It endangers our physical, mental health and well-being, and it threatens all areas of our aspects of our lives. We do get quite significant flooding within Wales by our standards. So what that means is we do get annually quite significant disruption in terms of heavy rain, in terms of inland flooding. What you can see here in the picture is a picture of one of our floods that happened in the last couple of years. And that picture shows people who are canoeing down a high street. That would normally be a road. And I think you can see a young girl stood to the left-hand side of that image, just to give a bit of scale of it. So we're not talking significant devastation in terms of very high level floods. They're not particularly deep necessarily, but they are very disruptive to our infrastructure in terms of how people are able to go about their daily lives, access education and employment, and generally go about their daily livings. And we do see that repeatedly in a number of our inland communities. We acknowledge that there are significant challenges that this brings, not just from repeated flooding, but other extreme weather events that we have and other effects of climate change. And so Public Health Wales in the last couple of years has identified that tackling the public health effects of climate change is one of our 6 key priority areas that we want to focus on as an organisation. And I lead that specific stream of work with Sarah and other colleagues across the organisation. So a couple of years ago, you'll have had my colleague, Dr. Liz Green, talk you through the health impact of climate change in Wales. And this was a report that Liz led on that I think some of you may have seen previously, that really tried to understand an assessment of what climate change will impact health in Wales and the areas that we can work to try and mitigate some of those areas. This work was led by Liz and colleagues, and it was started prior to the COVID-19 pandemic. But given the severity of the potential impact of climate change, we were able to progress this work throughout the COVID-19 response and bring it through to publication a couple of years ago. And I'll be able to provide a link to that report at the end if anybody's interested. The climate change health impact assessment really focused on these 3 key focus areas identified by the WHO in terms of the areas that we would expect to see significant challenge in relation to climate change. So the first is really around the wide range of health impacts on climate change. So what would we expect to see in terms of a changing climate, in terms of what that would mean for people going about their daily lives within our communities? That will look different to different communities. So in Wales, as I said, with that kind of temperate maritime type environment, what we would expect to see is longer, hotter summers and warmer winters. So we do get quite cold winters currently, but we might start to see them become less severe. That will have potentially some different types of responses. So we might start to see a slight reduction in the levels of influenza-like illness that are circulating, less snow and ice on the roads and pavements, so less slips, trips and falls for people, fewer fractured neck and femurs potentially going through into our secondary care system. So there are potential benefits from having a slightly warmer winter. But what we would expect to see is actually that having those higher temperatures during the summer months impacts a whole host of areas, such as our ability to grow and maintain crops, to ensure that we have sufficient food security and be able to feed people, but also that disruption from extreme weather events, and also kind of increase in tick-borne viruses that we might start to see enter the United Kingdom that we don't currently see to any great extent. So there's a broad range of health impacts. And then secondly, it's really about our ability of our National Health Service. So we have a state-funded, taxated health service in the United Kingdom called the National Health Service, where we would expect to see some quite challenging situations within that environment in terms of our ability to treat the health effects of climate change and put pressure on our already challenged National Health Service infrastructure. We would also expect to see that the level of disruption caused by extreme weather events might prevent people from accessing things like their routine screening appointments. It would might make it difficult for people to access roads to get to hospitals. There was a whole host of challenges that we would expect to see from climate change and extreme weather in terms of people's ability to access and maintain good health within their communities. And then thirdly and finally, it's about promoting some of the health co-benefits of climate change in some other sectors, particularly around some of the mitigation areas. So particularly that might be looking at how we can mitigate the health impacts of, say, travel. It might we might want to say trying to have that shift from kind of that modal shift from transport, from kind of the reliance on the car over towards public transport and active travel such as walking and cycling. So there's a whole host of benefits and challenges that we need to think through really in terms of how we approach how we tackle our approach to climate change. I'm going to talk you through a few infographics now that talk to some of this in a bit more detail. So in the top right hand corner, you can see the projections that by 2050 in Wales, we would expect to see an annual temperature increase of around 1.2 degrees C. This doesn't sound like a lot, but actually does impact. We are very heavily reliant on, we are very agricultural led environment. So we have lots of farms, lots of farmland around us. And actually that 1.2 degrees will impact our ability to grow and maintain crops and livestock. And it also will impact potential influx. We are a very tourism-led industry, particularly around our coastal areas. So there are challenges in terms of what those future projections look like, especially because around that summer rainfall. So summer rainfall is expected to decrease by about 15%, which brings challenges which Sarah will touch on a bit later in terms of drought, private water supply and wildfires. And then water rainfall is expected to rise by 6%. Now, we are already quite wet as a country in terms of our climate. And actually that 6%, if we're kind of thinking through about increasing drought in summer and then quite high levels of rainfall coming through, that impacts this. We have challenges around soil erosion and soil degradation that will impact across all factors of life, really. And then the sea level projections are around 22 centimetres, which doesn't sound a lot, but we have a large coastal community here within Wales, and that is very low-lying coastal areas, and we're already seeing some challenges to that in terms of our ability to maintain and sufficient levels of flood defences around our coastal regions. So climate change is already happening in Wales. We do already experience kind of an increase in extreme weather and flooding, and that brings a number of challenges for people in terms of their mental well-being and air quality also. We know that people who live in our high frequency flood areas find that very challenging and stressful to live within those environments. And people who own their own home will find it difficult to be able to sell those homes and insure them appropriately. And that creates a huge amount of stress, aside from the initial impact of flooding itself. And then we know that there are certain groups which are more vulnerable to the impacts of climate change, so particularly our older adults and our elderly population. What we have across North Wales, which I think if you can have a look in that hand picture that's in the top centre of the picture, there is the top part of North Wales, which is where I live, is we have quite a lot of people that retire to the sea, retire to the coast. And so we do have a lot of older people, particularly living around our coastal areas. Lots of care homes also. So that will present challenges in terms of people's ability to live well within those communities, particularly where they're potentially impacted by extreme flooding and extreme weather. And then we've touched on a bit around that food and nutrition. You know, as we say, we're very a country that's reliant on agriculture as a significant source of industry. And if we're not able to grow and maintain crops and maintain that food security, then that will present challenges in terms of how we're able to feed people and feed them well. Obviously, increased heat has an impact for us, so we would expect to see increases in heat, and we're already starting to see that really. That presents challenges for schools and other educational settings, workplaces and homes, and particularly hospitals, because whilst we're also experiencing higher levels of heat, we understand that we can't rely on air conditioning to present the solution to that, because air conditioning is very heavily reliant on carbon emissions. So it's about how do we make sure that we maintain an appropriate level of cooling within our care homes and hospital environments so that the physiology of people receiving medications or treatment isn't negatively impacted by those rises in heat. And that's a real challenge for us in terms of how we're able to meet our net carbon zero goals whilst also maintaining an appropriately temperatured environment. And then we've touched a bit on accessibility to healthy food, but this infographic gives you a bit more detail on what that looks like. We would expect to see that poverty and cost of living, we already have significant levels of poverty and cost of living crisis here within the United Kingdom and elsewhere parts of Western Europe, really. As inflation rises and as global geopolitical challenges increase, we start to see the accessibility and availability of food decrease. And so actually how we keep people healthy within that context is a challenge for us, and climate change has a potential impact to that around soil erosion, soil degradation, flooding, and then drought. That cycle of flooding and drought in terms of food security is a real area that we're kind of trying to focus on. But also thinking about it from a more broader perspective, nature supports our health and well-being, and so it's thinking about, well, thinking about the whole picture really in terms of climate change and health is around social well-being. We want to make sure that people feel that they're able to live well within their communities and that those communities are stable. And climate change has a real role to play in making sure that communities and countries feel stable to live in. You know, there's that juxtaposition of climate change and kind of societal breakdown is we want to make sure that we are living in a stable country, and potential increases in extreme weather and extreme heat could lead to some of that stability loss. And it's about, well, how do we make sure that people are able to live well and healthily within their communities, within that kind of changed climate setting? So thinking through about all of those different factors, what we've been trying to do within Public Health Wales is think through, well, what's our particular approach that we're able to offer in terms of tackling the public health impacts of climate change? I don't know if you've heard of the International Association of Public Health Institutes, which is shortened to IANFI, but IANFI is an international organisation that brings together public health institutes from across the globe to share information and resources around common areas of challenge. And IANFI have pulled together this framework around how can public health institutes really play a role in tackling the climate change impacts on health. And I wanted to draw your attention to this diagram on the right-hand side of the slide, which talks about a kind of three-phased approach, which really is talking about what's our role in protecting, promoting and educating the public around climate change? How can we make sure that those conversations around the health effects of climate change are palatable to people, so they're able to not to disregard it but actually to say, oh yes, actually this is something that I understand concerns me and concerns my ability to live well within my community. How do we advocate and for policy and outreach, and how do we promote healthy lifestyles and environments? Then also about how do we respond and facilitate action? Because as public health organisations, we have certainly in Public Health Wales, we are accountable for the response to any kind of extreme weather event or significant health event that happens within our geographical domain. So how do we respond to incidents of extreme flooding? What's our response to people who are experiencing those kind of extreme weather events on the ground? And how do we bring in a multidisciplinary workforce to support people when they're experiencing the effects of climate change? And so we've got a role to play around that element also. And then finally, through to monitoring and evaluation, you know, many countries across the globe are setting up surveillance systems around how do we capture the climate change risks and impacts on health? What are the main things that we need to look at? And so Sarah and I and colleagues across Public Health Wales have been thinking through, well, actually, how many people do die from heat-related heat in Wales? How does that compare with other countries that are similar? And what's our level of heat-related morbidity that we might expect to see? So really starting from that position of heat-related mortality and morbidity, but then thinking through around, well, how could food insecurity impact? What about vector-borne diseases? You know, how are we monitoring those? And so a significant amount of our work at the moment is around what goes into that climate change surveillance system and how do we monitor that and how do we work with other organisations globally? So this, I think, gives you a bit of an idea about where our thinking comes from in terms of our approach to climate change in Wales. And what we've done is we've taken this IANFI framework and developed that through into developing our route map for how we would expect to see, as an organisation, how we'd expect to tackle the public health impacts of climate change going forward. And we regularly collaborate with other partners across the UK and internationally also. So finally, for the last couple of minutes of my presentation, I just wanted to talk you through some specific examples around our work within our microbiology labs. So as I said, we run all of the microbiology labs across Wales, which are located within our district general hospitals. And globally, we know that single-use plastic and waste in labs is a significant challenge for any type of health system across the globe. Globally, labs produce about 5.5 million tonnes of plastic waste in 2014 alone. So that was prior to the COVID-19 pandemic. And if you think about how we've had to step up globally around our public health response, I would expect that 5.5 million tonnes to be a gross underestimation in 2025. So single-use plastic and waste is a significant challenge for us. And as well as trying to tackle the public health impacts of climate change, we have a responsibility for thinking through our own approaches to our own ways of working. And one of the things that we've been trying to do is think, well, how can we reduce our own waste within our own labs? over the past couple of years, we've been having a lot of work within our microbiology lab estate, looking at how we can save the carbon footprint. And we've been looking at pipette tips. So if you think about the work that goes on within microbiology labs, you have agar plates, you have pipette tips, and actually they all have quite a significant carbon cost to them. And we've been trying to reduce our reliance on, excuse me, I'm getting phone calls. I'm trying to turn my phone off. Trying to work through actually how we can start to reduce our climate impact of some of this waste that happens within our microbiology labs. So what we've been doing is working directly within those labs themselves to try and track the carbon footprint of some of the different processes that we have, whether it's our use of Petri dishes and agar plates, and thinking through actually to the printing that we use. And this last slide here finally gives you an indication of some of the workshops that we've been doing, where we've been trying to think through how we can reduce various elements of waste within our labs. So we've been able, if you think about when a lab prints off a report, it prints that off on paper, but actually can we reduce the amount of paper that we're printing those lab reports off on? And actually by making small changes, but across a large domain of our practice, we've been able to save around 30 tonnes of carbon emissions just in a year alone, really. And that's the equivalent to about 30 flights from Paris to New York. So the moral of the story really is that as a public health organisation, we have a commitment really to tackle those public health challenges related to climate change, both externally in terms of how we talk about climate change and the risks to people, but also internally in terms of how we work ourselves and the challenges that we can, the steps that we can take to work within our own environments to think through, well, what can we do? Even if it's only a small change here, actually small changes, when they're scaled over a large degree of practice, can actually have quite a significant impact. And that's some of the work that we're trying to do at the moment, really to reduce our own carbon footprint of the work that we do. So I'm going to stop sharing now, and I'm going to hopefully you've all been able to hear me okay throughout that presentation. And I'm going to hand you over to my colleague, Sarah, who are going to talk you through the next step of the presentations here today.
Thanks, Rebecca. Thanks all. Hope you can all hear me okay. As mentioned previously, I'm Sarah Jones, and like Rebecca, I've been working in public health for many, many years now. I actually started off in sports science with postgraduate and undergraduate degrees before moving to an academic career in injury epidemiology. And in 2009, thank you, Vikas. In 2009, I became a consultant in environmental public health with Public Health Wales. And actually, it was a background in sports science that really developed my interest in transport, because what I'm really interested in is how we encourage people to be physically active, how we encourage people to continue to participate in physical activity throughout their lives to improve their health and their general well-being. And over time, that's developed into an interest in road traffic crashes, and then more recently into how we could reduce the speed limit, as we did here in Wales, to a default speed limit of 20 miles an hour, which happened on the 17th September 2023. And all of these efforts actually have been linked back to those initial undergraduate studies. More recently, when I've been a consultant in environmental public health, one of the things that we're involved in is the response to extreme weather events. And of course, over recent years, in the changing climate, we see ourselves responding to more and more extreme weather events. But of course, we're very aware that actually the point that you have an extreme weather event is really almost too late to protect health and to prevent harm. Actually, there's a lot more you need to be doing well before the event if you're going to see the greatest health benefit. What I'm going to do is I'm going to talk in a bit more detail about what it is that we're doing in Wales around a couple of specific areas, what my team in particular is looking to work on, and one of my fabulous colleagues, Paul, is actually on the call as well. I'm going to take you in a little more detail through some of the work that we're thinking about on flooding, what we're doing on private water supplies, some particular challenges that we've got in relation to coal tips and wildfires, and some of the emerging issues that we've got with data centres and battery storage. But as I've already alluded to, the more that we can do to prevent things happening, the the greater the overall health benefit in the long term. And of course, when we talk about climate change, a lot of this actually fits with the terms that we use to describe what it is that we need to do about the changing climate. We talk an awful lot about mitigating the effects of the changing climate and adapting to the changes that the changing climate brings with us. And that's really familiar to us all in public health. After all, we've talked for years about primary and secondary prevention. We've talked about the need to stop things happening. And we all know, as public health professionals, that actually you don't do one without the other. You don't do the adaptation without the mitigation. They're both really, really important. But the more you can focus on mitigation, the less you need to do in adaptation. So in recent years in the UK, we've had climate change risk assessments published. We're currently on the 3rd edition of the climate change risk assessment. This one's a few years old now. And there is a climate change risk assessment version 4 due in the not too distant future. It's produced at a UK level, but there are summaries for each of the nations of the United Kingdom. So there is a specific summary for Wales, and that highlights some of the changes that we've seen in Wales in recent years as a result of the changing climate. We've got an increase in average annual temperatures. We've got an increase in mean rainfall. We've got more sunshine, which of course bring positives and some negatives. There's a UK-wide increase in extreme weather events, and we've seen a sea level rise as well. Now, when we look at flooding in particular, we know that it is the most common natural disaster. It has direct risks in, which I'll come on to in a little more detail in a moment, but it also has with it, it brings with it significant indirect effects, because when floods occur, they don't just affect where people live, they affect all of the services that people need to use as well. And we know that the health harms that go with flooding itself can actually be brought about not just if your home is flooded, but also if services that you use, rely on and need are also flooded. So what we need to think about is the primary prevention, stopping flooding happening. And then this comes back to one of my key interests. How do we change our transport and our travel behaviours so that we're less dependent on cars, which we know are exacerbating and driving, pun intended, a lot of the changes in the climate? How do we move away from a reliance on cars to actually using more active travel and public transport approaches, which are going to reduce the risk of extreme weather events, including flooding? But flooding is still going to occur. I can remember flooding happening when I was a small child, before we were talking about a changing climate. So we need to be thinking more about the types of interventions that we need to put in place at the individual household level, at the community level, at the national level, to be able to reduce the effects of flooding should it occur. And then from my team's perspective, what we also deal with is the response once a flood occurs. What's the advice we need to get to people to help them reduce the longer term harms of flooding? What you've got on the right hand side of the slide there is a snapshots from the CCRA3, and they really express the extent to which infrastructure, services, and entire communities here in Wales are going to be affected by changes in the flood risk, and also emphasise how much more work we need to do in order to reduce the health harms that go with them. And when we look at the health effects of flooding, we know that there's significant mental and physical health effects. And these happen, as I've said already, to people who are flooded and those whose access to services is affected by flooding. We also know that there's a dose-response relationship with flooding. Flood water in the home is associated with more distress, more anxiety, more PTSD, more depression. But the more water that comes into the home, then the more distressed people are, the greater their anxiety, the more PTSD they suffer, the greater the depression. We know that certain populations are more at risk of the effects of the health effects of flooding than others. So we know that women, the unemployed, those with previous medical conditions, small children are at greater risk of mental health effects after flooding. And we know, for example, that people who have insulin-dependent diabetes have massively increased problems with controlling their diabetes for around a year post-flooding, because the way in which diabetes acts on our bodies and the things that trigger diabetic episodes are associated with stress and anxiety. So as I've already alluded to, one of the things that we need to do to stop flooding from happening is change our behaviours. We need to think about changes in our transport behaviours. We need to think about our heating and cooling and cooking practices. But we also need to understand why flooding occurs. And I love this video that thankfully has worked, because that's the first time I've ever tried this in a presentation, and I hope it's working for you as well. And what it shows is the way in which water soaks into the soil, and really emphasises that actually after a heat wave, it's really, really difficult for water to flow away. So actually the changes to our climate here in Wales, while we could see more warm weather, and normal is probably something, what we'd normally see in Wales is currently more like wet or normal. But as we see more and more hotter weather, we're more likely to get the cup on the right, where water doesn't soak away. And of course, what you've got with these cups is the water's being kept in the cup. What you'd have in reality is the water just running off the soil. So what can public health do? Well, I think there's a massive amount that we can do in public health, a massive amount to support both primary and secondary prevention. My team and I talk enormously about the need to change our travel behaviours, but we can also look at more direct effects. We respond to planning and permitting consultations. We can advocate for policy changes. So we know that in recent years in the UK, huge numbers of people have concreted over their front gardens to park their cars. They need somewhere to store their car after all, so they've concreted over their front gardens. And what this means is when you get a rain event, then instead of water soaking down into the soil, it just runs straight off into the drainage system, which is fine as long as the drainage system can cope. As soon as floodwater starts building up, the drainage system can no longer cope, and we get a flood event. So actually, there's conversation starting about things like taxes on impermeable surfaces. About, have we got to be thinking about whether people should have planning permission for paving over their front gardens? Should we limit the number of people in an area who are able to pave over their front gardens? We need to be thinking more about natural drainage and flood defences. We know evidence is beginning to show that natural flood defences are far more effective than man-made flood defences, because it's really just about slowing down the flow of water, not necessarily stopping or diverting it. And we need to maybe think about offering people incentives to revert to encourage them to revert to slower draining surfaces. So maybe if instead of concrete in their front garden, if they use a gravel or some other aggregate that actually allows drainage onto the surface rather than just encouraging water to run off. We're also thinking about whether we can start to risk map floods and combine this with population health mapping, so that we can identify at-risk populations and prioritise actions. When you've got massive areas that are at risk of flooding, you need to think about where to start. And then we need to question whether we need to be encouraging, sort of at the individual household level, greater use of floodgates, literally just a big gate at the front door that stops water ingress. Whether we need to encourage more people to lift plugs and sockets, so that if water does get in, the electricity system isn't affected and the effects of flooding are reduced. We need to think about whether population registers are appropriate, so that if we do get a flood event, it's much easier to identify people who need to be supported. But of course, it's not just flooding that's an issue. And Rebecca's already alluded to the fact that here in Wales, we are concerned about issues with private water supplies. We know we've got an increasing demand for public water supplies, and the majority of the population in Wales is supplied by mains water provided by a utilities company. However, large parts of Wales are really, really rural and are reliant on private water supplies to deliver their water. So this is any water supply supplying one or more properties, and that's what's critical here, that is not provided by a water company. So it's coming out of a borehole or a well. And in 2023, we suspect that around about 65,000 individuals, around 2% of the population, we're not a particularly big country here in Wales, were supplied with their water by a private water supply. And of course, you will all know from Maslow's hierarchy of needs that actually water is fundamental to our security and our safety and our living conditions. So while it is only 2% of the population, actually it is 2% of the population. That 2% is as important as the other 98%. And they're probably also people that don't have mains electricity or gas supplies. And of course, there are inequalities in the way in which these supplies are compromised, to the extent that in some areas, almost half of all properties could be supplied by private water supplies. And we've got relatively little data on these. For example, we don't know where you've got, say, a farmer who's recently built a number of homes on his property, how many users could be being supplied by those small supplies. And actually, in recent years, our research has shown that during planning permission for property building, actually provision of a water supply isn't a condition for granting planning permission. So there's a real gap in the planning system. What we have in terms of regulation is a system based on risk assessment. 20 years or so ago, it was decided that the risks of contamination of private water supplies serving single properties were sufficiently low that much of the testing regime could be abandoned. And I think now we're probably in a situation where we're looking at private water supplies and wondering whether those regulations need to be reinstituted. Because what we have in a changing climate is, in the first instance, concerns over quality of supplies, but in later period, we've got concerns with sufficiency. Is there going to be enough water? And what are the health harms that are associated with poor quality that we can use as an indicator of the population at risk and where we might be seeing problems in the future? Now, as I've said already, the data that we have on private water supplies in Wales isn't great. What we'd like to be able to do is almost have a register of homes that are on private water supplies that we could link with our health protection data, both here in the environment team and also in the communicable disease team, to actually accurately quantify the health harms that are associated with private water supplies and gastrointestinal disease resulting from these. Generally, we're seeing that the proportion of supplies that have got E. coli within them is decreasing, and that's been a decrease over the past 15 years. But there is a risk that the chart in the top right will start to increase again in a changing climate. And the types of issues that we see in a communicable disease context are things like Campylobacter, Giardia, Cryptosporidium. And in environmental context, we see failures for things like iron, manganese, and aluminium. And we know that compromises to private water supplies can have mental and well-being effects for people who use them. Generally, it's been perceived in the past that use of private water supplies believe that their supplies are better than the mains, but we really do have concerns that over time, this won't actually be the case. And we know that we've got real concerns over the different people within the population who are more likely to be affected by contamination of private water supplies. You see in the chart there on the bottom right that actually it's males, particularly young males, and then particularly older people, both males and females, who are more likely to suffer GI effects as a result of contamination in the private water supply, probably because they're more likely to be drinking more regularly from a private water supply. When we look in more detail at the chemical contamination issues, we see it's really difficult to elicit any trends at the moment, but we know that we've really got to keep a close eye on these data and on the data around failures that we know about, and we have no idea how many failures of the supplies that we don't know about, but we can see that they're really starting to emerge across the rural areas of Wales. So this is the health risks that go with them can be, with the private water supplies, can be associated with both heavy rainfall, because animal waste and storm drains end up being washed into the groundwater supplies that can then contaminate the private water supply. We can get drought, which is going to lead to insufficiency, and we've got less clear evidence for contamination around that. But we also know that other factors will affect the way in which the private water supplies are affected, including changes in livestock patterns. We've also got indirect issues associated with changes in abstraction needs of industry and planning processes that don't necessarily account for the importance of having a water supply. So what next? Well, we've recently undertaken a really substantial piece of work. My colleague Anna Schwapach did a fabulous job of trying to collate the data that we have available to date and coming up with a number of recommendations that we're now going to be working on to try and reduce the health harms associated with private water supplies. Now, here in Wales, coal tips bring with them are well known for taking with them a large number of lives. In the late 1960s, over 100 children were killed in the village of Aberfan when a coal tip basically slid down a hill onto a nearby school, and this actually happened after a period of heavy rainfall. And I think it's something that we all need to be mindful of, because actually this was an indicator of something that could happen. And whenever you talk about coal tips here in Wales, it brings with it thoughts of Aberfan and what happened there. Wales has a notable industrial heritage, to the extent that we now have around 25,000 disused coal and non-coal spoil tips. And in recent years, Welsh Government have realised that there is a very real need in the changing climate to address the fact that these tips need to be monitored and secured in a changing climate. And given that we are in a post-industrial period, the tips have been abandoned, we've moved out of a mining industry, but the tips still exist, and large numbers of them are in areas near to where people live. So what Welsh Government are looking to do is encourage owners to take greater responsibility for tip management by identifying those who are at highest risk and requiring more monitoring and more stabilisation of those tips. But what we know is that in the changing climate, both water, so rainwater, and also drought and wildfire can affect the stability of those tips. And it's really, really important that we take steps to secure them. But we know that actually just the process of identifying the location of these tips can, of course, have unintended consequences. And we've been really concerned here in Public Health Wales that consideration is made of the potential mental health effects that go with people being made more aware of what may have been forgotten tips and what may bring back concerns over the possibility of things like the situation that we had at Aberfan happening again. And I mentioned wildfires in relation to drought and coal tips. Wildfires are a problem here in Wales. They're a well-known social issue. Rather than the heat starting wildfires, we know that, as happened in LA in recent weeks, actually large numbers of them are often deliberately started. Lots of efforts are underway to try and address the societal problems that go with deliberately started wildfires. But the reality is, we also know, as I'm sure you do, that even what appears to be a very small fire in the first instance can, with higher temperature and water scarcity, soon spread rapidly, as happened in LA. You know, it was a combination of wind, temperature, scarcity, and before you know it, you had fires spread over very, very large areas. The health effects that go with them, we have large numbers of valley communities, and it's in the valley communities of South Wales in particular that deliberately started wildfires are a particular problem. But the air pollution that goes with them can then lead to smoke becoming trapped in valleys and people suffering negative health effects as a result. That can also lead to water contamination, which brings us back around to our private water supplies issues. Probably less of a problem in the South Wales valleys, but in other areas of Wales that are reliant on private water supplies, if you've got contamination associated with wildfires, then that's another way in which our private water supplies can be compromised. We know that there are also a number of health effects that go with those wildfires. Finally, moving on to data centres, and this is something we are beginning to be concerned about. And I'm aware that I'm over my 20 minutes, so I am aiming to speed up a little, Chair. But data centres actually are emerging globally because they are needed to store the vast amounts of electronic data that we are all producing and needing and consuming on a daily basis. Enterprise computing facilities have now turned into hyperscale systems covering hundreds of thousands of square meters, and it supports the growth of our reliance on electronic devices. But there's the potential that these data centers could actually have health effects, both positive and negative. We think there's potential for air and noise pollution during backup power generation, possibly an acute risk during generator use. They are likely to have high water need. We're back to our private water supply concerns, high energy demand and high carbon emissions, but they could bring with them data security and employment. And there are controls that my team and I are looking at whether they can be put in place during the planning phase of these sites to actually ensure that any health harms are minimised. We're actually, with Rebecca's team, looking at whether we can produce a health impact assessment of data centres and associated battery storage to try and increase awareness of some of the problems. And we're particularly concerned about fire and noise management and high water use. Once a lithium battery catches fire, we all know that that's really difficult to put out. Associated with these, we have battery energy storage. Some may be with data centres, some may be separate from them. And those battery energy storage is needed to store energy, to provide to fuel data centres and the grid when renewables are no longer available, or to avoid the need for generators. Again, they come with positives in terms of stabilising the power supply and employment, but may also have negative effects in terms of carbon emissions and the effects associated with fire and explosion. I'm happy to take any questions. Diolch yn fawr iawn. Thank you for listening.
No, thank you so much. That was just wonderful. Lovely presentations. We do have a number of questions, a few in the chat, and we've also received a few offline as well. So let me try to put these sort of into groupings, if I might try that. I think Henry had the first couple of questions, so maybe we could go to those first two from Dr. Falk. And I think I saw that Rebecca is going to try to tackle those. And Dr. Falk's questions were related to sort of a two-part question. How does Wales coordinate and integrate with the rest of United Kingdom on climate change? And given the extensive coastline, I presume both for both Wales as well as the UK in general, what is the impact on the fishing industry? Rebecca, were you going to tackle those two first?
Absolutely, I'll certainly give it a go. They came up while Sarah was talking, so I thought, well, I can try and put some headspace to thinking those through. So the coordination one is a really interesting element because obviously we have 4 different public health national institutes here in the United Kingdom. Public Health Wales is one of them. And then within that, we have regions and sub-regions where we have public health activity also. So actually how we coordinate across a relatively complex system is a key challenge for us. Nationally, we have a coordination group that sits with my colleagues in Public Health Scotland, colleagues from Northern Ireland, and also colleagues from England, from UKHSA, the Health Security Agency, where we come together and we share good practice and we work together around common challenges. So one of the common challenges that we're working through at the moment is around heat mortality and how we ensure that we're using the consistent methodology. Because what we want to do is to ensure that we are not, there is a risk that if we use different methods, we can come up with different numbers. and that will diminish public trust in the information that we're sharing, really. So ensuring that because we're all publicly funded, we're all government funded workers, it's important that the taxpayer gets the best bang for their buck, so to speak. And so we work collaboratively together across the 4 nations around not just this climate change work, but for a number of other key strategic public health areas as well. So that works generally okay at a UK-wide level. There are then differences around how we integrate that work within our local areas of practice, because much like in other areas globally, we will have differences in terms of how public health is delivered on the ground. So that presents a bit more of a challenge for us. Within Wales and Scotland, public health is generally delivered by the National Health Service in partnership with our local government colleagues, whereas in England it's delivered primarily through our local government colleagues. So there is differences in terms of how we manage that. But what we tend to do is really focus around how we can share information and ensure that we're not duplicating practice. And then also, because we are public health professionals, we are registered with a national body called the Faculty of Public Health, and that is a UK-wide faculty. And so we have a special interest group that sits within the Faculty of Public Health, where we come together and we share information via that route also. So there's a number of different routes, really, but really the focus is around coordinating and integrating really on a UK-wide basis, so that we're not duplicating areas of practice and that we're sharing our resources fundamentally in the best way possible for the taxpayer.
And then the second part of the question was about the fishing industry and fisheries.
Yeah, of course. So we have approximately 200 fisheries in Wales, and many of those are inland fisheries, I believe, where in terms of fishing within our rivers. Sarah, please do come in and correct me where I'm wrong in this one. The fisheries isn't a particular area that I'm aware of, but we have something called the climate change risk assessment. So every 5 years, the UK government undertakes a risk assessment of the climate change risks within the United Kingdom. And then we have national profiles for those. I'll pop the Welsh one into the chat for you, because there is a whole chapter within that section around fisheries and the fishing industry. And broadly what it says is that actually we don't fully understand the challenges. We know that sea level acidity is a particular challenge in terms of the health of the fish within those fishery environments. But actually we need to undertake a bit more further work to understand the potential impacts of that. That work is led not by ourselves in public health, but within our environment agency and our natural resource colleagues who sit outside of health, and we work really closely with them. So actually, and lots of this work is done on a policy level within the government. So we sit slightly, although we are paid for by the government, we sit outside of government in terms of our practice. But I'll pop a link to the report in the chat, and there's some quite nice information within that around the fisheries impact specifically.
Excellent. Thank you. There are a series of questions about collaboration, particularly related to health impact assessments, but perhaps more generally as well. So I may try to sort of group them together just for sake of convenience for both of you. And either of you could tackle these, or feel free if both of you would like to comment. The one is about the barriers to implementing health impact assessments. There's a specific question from Dr. Cherian, who had to just step out for a moment, but it was about how can Wales collaborate with others to share best practices? And he was specifically asking about heat. One of the things we're thinking about quite a bit here at PSPH and in India in general, you can imagine, is the impact of heat and extreme heat events, and whether there might be an opportunity, for example, to collaborate on developing at least a framework for heat action plans and so on. And then Dr. Prakash just put a question, was one of our faculty here at PSPH, one of our senior faculty, and he just put a related question in the chat as well about whether there are any specific examples of, as a result of these assessments, examples of mitigation plans that you can mention or talk a little bit about. So this whole thing about collaboration, the impact assessments, whether there are opportunities to collaborate, and how, whether there are examples of mitigation plans based on the assessments.
I think the challenge we've all got in a changing climate is we can all see, we all recognise that it's a global emergency, and I think it's another version of COVID after all, where actually we were in a global emergency and we had a rough idea of what we needed to do, and everybody was desperately trying to collaborate, and you're in a very, very high pressure situation. And I think that's actually what we're facing here, is we're all starting from a point of relatively little knowledge. And I think this means that if we're actually going to be able to reduce the health effects of the changing climate in a global manner, in an equitable manner, then collaboration is the only way to do it, because we can't all plough our individual paths hoping that we are brilliant enough to come up with the answers by ourselves, and that we'll do so before everybody else, because we won't. Actually, it needs all of us to share our insights and share our collaborative learning, because that is the only way we're going to get to a sensible endpoint within a reasonable period of time. We're always open to collaboration. Obviously, Rebecca's already mentioned that our colleague Liz has spoken with you before, and Liz is a real leader and real advocate for health impact assessment, to the extent that it's part of the legislative framework here in Wales now. And I think that's a great example of legislation that can be taken and used as an example of something that's a really important step in addressing the changing climate, and something that we can all look at how we share with other parts of the world, and in combination with our Wellbeing of Future Generations Act, are critical pieces of legislation that enable us as public health professionals to take steps to address the changing climate. Then below the policy level, we were on a call with colleagues yesterday, and we were talking about heat, and I think heat is absolutely fascinating, because I think what's critical about the evidence base there is, while it's going to be essential for us all to collaborate, we all are going to need to collaborate to improve our understanding of the interventions that reduce the effect of heat and reduce the development of heat as a climate event. But actually being able to come up with one number which says, actually, this is where you see the health effects, is actually going to require the local and the regional data. So it's being able to my mind, really effectively share knowledge and information on how we increase the provision of shade, for example, how we identify communities that are needing shade. We know that in Wales, the more deprived communities have less natural shade available to them than the least deprived communities. So what are the interventions and the strategies that we need to put in place to actually increase that shade, which is going to reduce the effect of heat? The temperature, the actual value, is going to be very, very different to that you see in India, for example. But actually the interventions are probably going to be very similar. So I think it's being strategic about recognising where it is we need to collaborate, and how it is that we introduce the interventions that allow us to reduce the effects on health.
No, I would agree with everything that you said, Sarah, and I think it's a real challenge to think through around that collaboration. Our main collaborative areas where we share information and engage with partners is really via the World Health Organization ATTACH programme, if that's something you're aware of, and also the International Association of Public Health Institutes by their climate change route. There is work underway to bring stakeholders together internationally to try and work through some of those heat frameworks that you talked about earlier. So I can try and find some more information about that specifically and share that. I'd be really happy to. In the meantime, we are trying to work through what our academic collaboration partners are doing in this areas. And again, many of us hold further academic qualifications and have an interest in kind of furthering this field. I get a sense also that there is a sense that perhaps we've done a lot of talking and researching, and actually it's about the time, and the area that I'm most interested in is how do we take that research and put it into good practice and actually start to deliver some of the areas that we're really keen to progress on. So I think some of it's around where there's specific gaps in terms of the areas that we know the research agenda doesn't quite tell us what we want it to in terms of some specific areas, but where we have the depth of research, actually where we need to do is move towards further towards action really, rather than assessment.
I have another sort of bucket of questions related to communication and engagement with various communities. So Dr. Christiane she's one of our international faculty here at PSPH from Brazil, and she put a very interesting question in the chat. Her background is in health communication, so I'm sure that's part of her area of strong interest. But the question has to do with bad news or difficult messaging, I presume, that people don't usually like reading bad news. And regarding climate change messaging, does communication with the public prioritize negative messages? Or how can we engage the public in this important conversation without being perceived as sort of alarmist? I actually had a communication-related question, which is sort of related to this myself, and that has to do with, in many countries, certainly in India, certainly in the United States, I'm not totally sure to what extent in Wales and UK, I suspect also true in Brazil, you do get a fair amount of sort of skepticism, if you will, some climate skepticism and some misinformation about climate change and its impacts on health and its impacts on society in general. There are lots and lots of issues related to the use of fossil fuels. All these countries have been, for centuries, dependent on fossil fuels and continue to be to a significant extent, whether it's coal or oil or gasoline and so on. So I guess my question is, what do we do about this sort of messaging issue? And how do we overcome this challenge? We don't want to be overly alarmist, yet all of us in public health, I think, are really alarmed. And so it's sort of this paradoxical place we find ourselves in. And Christiane, please feel free to jump in if I've misstated any part of your question. But let me turn it over first to either Sarah or Rebecca, or both of you.
I'm happy to. I'm happy to take the first stab at this one. So it's something I find absolutely fascinating, and something that I've talked about in various contexts over many years that I've been a public health professional. And one of the analogies I always draw, and in thinking about telling people things or not to do things, is smoking. And we've known as a public health community since the 1950s that smoking is really, really bad for your health. Yeah, here in the UK, as I'm sure in other parts of the world, there was a time when doctors have actually encouraged people to smoke, saying it was good for them. In the 50s, we started telling people that actually we were wrong and that smoking is really bad for them. And for the next 50 years, that was what we did. We kept telling people that smoking was really, really bad for them. And here in the UK, we made our messages increasingly strident, to the extent that we then put pictures of diseased lungs on cigarettes. And still, people just carried on smoking. And what changed the environment, quite literally, was when governments started to ban smoking in outdoor places. And actually, that forced people to change their behaviour. And so when I start thinking about climate messaging, I start thinking about that. And as I've already mentioned, I come from a background of sport and of road safety. And one of the things that we talk about in the road safety context is that interventions in the road traffic environment are grouped in three main areas. They're called the 3 Es. They're called education, enforcement, and environment. And actually, we know that in the road safety environment, focusing on education, and you do still need basic education. You do need to tell people the basics of how to cross roads and how to drive cars. But actually, where you see the really big changes, the really big gains in road safety has come from from enforcement or engineering. Engineering was the third E, not environment. Engineering and environment, they're part of the same E. But we've seen in road safety since the 1960s, when road traffic crashes, casualties and fatalities were at their peak, we started to see big changes in incidence of road traffic casualties in the 60s when enforcement and engineering changes were brought in. Yes, the education goes on as part of it, but we changed the way, we forced people to drive in a different way or forced people to travel in a different way. And I think these are critical when we think about climate as well, because I think we've already alluded to the fact that climate is more abstract than road safety. You've already mentioned that many people don't necessarily recognise the harms that the changing climate are going to bring to them. And the other thing about the messages is we know that they don't come without risk in themselves, that actually the messaging can create anxiety. The other thing we know is when you give people a message, for example, wear sunscreen, and I'm going to hold my hand up and tell you how imperfect I am here, because I am very, very imperfect. I'm brilliant at wearing sunscreen when I go to a hot place, when I go to Europe. I'm ginger, I'm very, very fair. I invariably forget sunscreen when I'm in the UK because I never associate the UK with being as hot as somewhere that I'm on holiday. So I burned a number of times, and I always burn in the UK. I never burn in a hot country, because even though I know I've got to wear sunscreen, even though I have sunscreen stashed all over the house, in my car and in my handbag, I still don't necessarily remember to put it on. And I'm pretty well educated, and I know the dangers of not wearing sunscreen. And we're actually often asking people who don't necessarily understand the harms or can't necessarily internalize them because they are so far in the future, or can't afford sunscreen, or haven't got the time to go out and buy it because they've got a million other pressures on their lives right now. We're asking them to do something that's just beyond them right now. And for me, I think we need to also be mindful that if people don't take on board those messages, we're actually in a form of victim blaming if they then become ill as a result. And that risk really, really worries me. Whereas actually, as a society, we can provide more shade. One example, and it's a bit of a soapbox of mine, but actually, yeah, we still need people to wear sunscreen, but that requires more people to think less. It protects the people who can't go out and buy sunscreen. And sunscreen, of course, is a very narrow part of this. It's just an example. But actually, if as a society, we can encourage the greater provision of shade, which will have a various other associated effects, including to cool the local environment, then actually we're going to make it much easier for people to do what it is they need to do.
Yeah, excellent. I think that this whole issue of, I think the analogy with road traffic and tobacco is actually a very useful one. We think of sort of these hierarchies of public health interventions, primary and secondary and so on. And this is a big problem, and it's probably sort of a multiple approaches of necessity. But clearly those kinds of administrative, if you will, or engineering kinds of interventions that you talked about are preferred rather than just depending on individual behavior and so on. So sort of this package of interventions. I'm still very interested in how, and to Christiane's earlier question, how we're going to tackle this in places like India and the United States and Brazil, which are a whole different sort of scale of issues compared to a place like Wales, for example. But nevertheless, I think your point is very well taken. We have just a few minutes left, maybe for one or two more questions. I think thank you to Rebecca. I think, Rebecca, you put some resources in response to Dr. Talati's question about the dairy industry and climate change. So thank you for that. There is a question from Alyssa here in the room and from Dr. Vani regarding mental health. And there are growing research and growing evidence on climate change and mental health. Is your health impact assessment work addressing this? And do you have any, also corollary to that, do you have examples of community health initiatives within these discussions related to health impact assessments? And how do you engage with communities? I think that's sort of the gist of it. So that, and also the mental health piece. It's an area I think we're quite interested in here at PSBH. So, Rebecca,
happy to talk to that one. Yeah, thank you.
you.
It's a really interesting one. To give an example from Wales, there's an area of Wales called Fairbourne in North Wales, which is a low-lying. It sits below sea level. It's not far from where this picture was taken, actually, and it was a part of Wales that was inhabited during the Victorian era, where people would move to the seaside from England, and it's a Welsh-speaking community. It's a Welsh-speaking county, but people that moved to the area were actually English speakers themselves. So it's an anomaly in terms of North Wales, because actually Welsh is a predominant language across that county. And this is largely an English-speaking community. But the interesting thing about Fairbourne is that there was a challenge around it, how we maintain its flood defences, given the cost of those flood defences and the scale of the challenge in terms of rising sea levels to that community. And I can pop into the chat a news article that kind of gives a bit more context to Fairbourne. But lots of the challenge there was around how do you support community members in knowing that they have this existential threat on their doorstep of rising sea levels, and the challenge of being able to continue to provide very expensive flood defences within that system. And there was a lot of work done by our local health partners within the local area around engaging with local community members to talk through them, find out their main concerns and talk through them about, well, how can we support you in these concerns? And eventually the flood defence systems have been maintained, and it's not a current existential threat to that community. But it really highlights that the UK does experience challenges in terms of having to potentially move entire communities away from the coast and resettle them, where we have existential threats, particularly from coastal erosion and coastal flooding. And it speaks to that broader challenge around how we support people from a mental health perspective. So in the UK, in the United Kingdom, we have a piece of legislation called the Climate Change Act, which was brought in around 2008. And it places a requirement on the UK government to undertake an assessment of the climate change risks every 5 years. And that report is called the Health Effects of Climate Change. And what we're doing at the moment, I can link again through to a resource that describes that. But what we're doing at the moment is some work engaging across the UK around specifically the mental health challenges and the mental wellbeing threats that we see. not just from the changing climate itself in terms of having to live with increased flooding, increased weather events, but actually to live with that climate anxiety. I think one of the comments in the chat around the communication elements talks about engaging children and young people within those within that comms, and I completely agree with it, whilst also acknowledging that there's a real challenge in terms of spreading fear amongst children and young people around the threats to their own future. We have legislation in Wales, which is unique to Wales, called the Future Wellbeing of Future Generations, and it places on us as public bodies a real need to ensure that we are thinking about the health needs of people born in the future. So they're not born today, but they're people born tomorrow and into the future, around considering their needs. And it's based around the United Nations Sustainable Development Goals. And I think that framework helps us to think through, well, the decisions that we make today will have an impact on us as people who live and work in Wales, but it will have an impact on people born in Wales, not just in the near future, but the far future as well. It's really world-leading legislation that places that impact on public bodies. And I do see this mental health challenge as being a good example of that. I don't have any concrete examples to be able to share with you, other than to say that it's an area of work that we are also working through at pace. But what I can do is pop into the chat some specific examples of national frameworks that we might have in the UK around thinking through some of these challenges. And what we're doing at the moment is working through with our local partners on the ground about how we can plan for and put in place elements of support to people in communities that might experience these existential threats on their doorstep. And sorry, and I picked up to finish finally the agricultural element that I think somebody popped into the chat also, and I know I linked to an article. That health effects of climate change report that I referenced comes out of that specific bit of legislation, and there is work underway at the moment to work through and engage with agricultural partners and key experts around agricultural provision in the UK around how we identify the specific threats to agriculture UK-wide, not just within Wales, but on a UK basis. So as well as the bit that I pointed to into the chat, there is ongoing work within the United Kingdom to understand the existential threats within the agricultural industry and that food production industry as a whole.
Well, fantastic. We do have a few other questions, which we may share with you offline. And if you all have thoughts about those, we will be happy to share those back, or any resources. We will be happy to share those back to the people asking those questions. So in the interest of time, I think we are going to wrap up. It's fairly late here. It's almost 7. So I can't tell you both, again, how much we appreciate your willingness to do this and working through with us all the different challenges and the preparation calls and so on. Wonderful presentations, and I think you can clearly see there's a lot of interest in the topics that you presented, and I think that hopefully, if nothing else, people will walk away from the meeting today thinking about some of the opportunities we might have to collaborate going forward. And also thank you for sharing the resources that you have shared, and please feel free to keep those coming, and we will disseminate those here with folks here at the school and at the university, and very much look forward to keeping in touch with you over the next few months and years, and potentially figuring out ways that we can do some specific and concrete ways that we can collaborate. I know that is on Dr. Cherian's mind, as was evidenced by the question that he asked. So there are a few of us here in the room, so we would love to give you a round of applause, and those online should please feel free to send some online applause your way. Thank you very much, and we will be in touch in the near future. Thank you.
Thank you. It's been an honor. Good to see you all this evening. Take care.
Thanks to all for joining.
Have a lovely weekend.
as well.
Take
Thank
care.
you, Sarah.
Bye-bye.
Bye.
All right.